My name is Brian. Can you hear me? Testing, 1, 2, 3. Hey guys, my name is Dr. Brian. I'm the chiropractor here at Holistic Spine and Orthopedic Clinic. If you've been dealing with shoulder pain, if you've noticed that lifting your arm, exercising, or even while you're at work, you're experiencing a lot of sharp pain in the shoulder, this could be arising from something called shoulder impingement. Shoulder impingement is a condition where underneath this process, this is called the acromion process, we have 4 rotator cuff muscles, and they traverse underneath these bony projections from poor posture, repetitive motions, like playing sports. Our tendons can become inflamed, and as we lift our arm, our scapula starts to move forward. Over time, as we see a decrease in this space right over here, these tendons can become pinched. And once they become pinched, they become inflamed, and then a whole cascade of other conditions start to happen. You might have a pinching sensation when you raise your arm. You might notice a lot of weakness and fatigue. And sometimes you can even get numbness and tingling around the shoulder area that can also be misdiagnosed as some sort of radiculopathy in the neck. Shoulder impingement is what happens when we do too much too soon from poor posture and repetitive motion. So different ways that a chiropractic therapy can help is we can address the muscular imbalance that happens in the shoulder. For example, typically with shoulder impingement, our scapula is pushed forward up, and what we like to do is we like to target certain muscles like the pec minor and the subscapularis. We like to bring it through its active range of motion and do a pin and stretch motion towards the muscles to help release a lot of the adhesions. When we release these adhesions, what happens is the shoulder is able to naturally move. When we combine this with exercise rehab, this helps restore natural motion over time, and it can help lead to a lesser inflamed shoulder tendon. So in this segment, we'll be kind of going over a couple of different exercises that we can be doing at home. So the first thing that we need to learn when we're doing shoulder exercises for shoulder impingement is how to control your scapula. So what I mean by that is, a lot of the times with shoulder impingement, the root cause is a shoulder blade, a scapula that is too far anterior and putting your acromion in a very compromised position. So learning how to control your scapula is going to be vital. How do we do that? We can do that by bringing our shoulder blades up and down, trying to giving yourself a feel of how your shoulder blades should be moving, and try going back and forth, right? So once we're able to see our shoulder blades and feel it moving along, what you want to do is you want to raise it up, back, and then down. This puts your shoulder in a retracted position. When you're doing a lot of these exercises, it's going to be very important that we keep our shoulder in this position. So we're going to help the muscles in the lower trap and the lower trapezius with this first exercise, bringing our shoulder blade back and down. So for the first exercise, what you're going to go ahead and do is you're going to have a resistance band, and you're going to be about a foot or so away from the band, and you're going to bring your shoulders back and down, okay? With this position, you're going to take the band, you're going to have your arm all the way out. You can have a slight flex in the elbow, although it's not necessary. And what you want to do is you want to squeeze and bring the band all the way back while still maintaining this position. Again, your shoulders are going to be back, down, and in. And with a nice squeeze, you want to make sure that you are pulling the band back and having a good contraction in the lower trap. You can repeat this simple exercise 3 times with repetitions of about 10. What we're going to do next is we're going to train one of our bigger rotator cuff muscles. This is called your infraspinatus, and what this muscle is going to help us achieve is external rotation, and again, that can help with our shoulder impingement. So what you can do is you can take, I have a foam block, you can take a towel, wrap it up and put it underneath your armpit, And when you're doing this exercise, we're gonna do an underhand grip with the resistance band. And when you're pulling the resistance band away, what you wanna do is you wanna try to take your elbow and drive it into the towel or into your torso. So again, with the resistance band about shoulder width apart, we're gonna do an underhand grip, and we're gonna slowly press the elbow into the side and externally rotate the arm out, just like this. And we can repeat this 3 sets of repetitions of about 10 to 15. Conservative care like chiropractic therapy and exercise rehab isn't enough to help with the condition. We have a team of pain management physicians that can offer a variety of modalities such as steroid shots that can really help reduce the inflammation, improve the range of motion and mobility, and improve the quality of life. So if you have shoulder pain, don't hesitate. Feel free to reach out and give us a call.